Senator from Suffolk, Ms. Chang-Diaz.
Thank you, Madam President. I rise first to express agreement with the gentleman from Barrie on something that he said earlier in debate on this amendment about Canada and comparisons to Canada. And it's important, I think, to note that in making comparisons or looking at what's going on in other countries, it's not to say, it's not for us as a state and not for me personally to say that we need to do it exactly like they do it in X country or the way that they do it in Y country or in Z other state in our 50 nations, but to say what is going on in the rest of the world and the rest of our countries. What things are working, what things aren't working, and what can we learn from these other examples. And I think it's worthwhile to undertake that thought exercise. I would note I, too, have a close relative, actually my little sister, who is up at McGill for the last couple of years and have had an opportunity to learn through her experience. And there are some pros and some cons, some things that I would say we should mimic, some things we clearly shouldn't mimic. The gentleman from Barrie cited the example of the 84-year-old and what kind of care that you might get under the Canadian system there. And that might be a place where we would say, no, we want to do it differently. We want to preserve the best of what we have here in Massachusetts, and we would bake that in to the benchmark, bake that into the model of what we consider high-quality care in Massachusetts. But it's also worth noting that in Canada you have a greater likelihood of living to be 84 than you do here in the United States to even get to the point where we consider what kind of care do you get when you're 84 years old. And it's foolish for us, Madam President, to refuse, it's foolish and stubborn for us to refuse to even look at what other countries and other states are getting right, and how have they been able to succeed or fail, either one, at providing high-quality health care at a lower cost to their citizens in the way that we, too, are interested in doing here in Massachusetts. I also wanted to note, Madam President, the gentleman from Uxbridge raised the T word, the specter of taxes. And I would say to that our residents here in Massachusetts know that they are paying through the nose. Whether you call it a tax, whether it's something that they pay through the private insurance market or the highly regulated life-saving service, as the previous speaker noted, Massachusetts residents know that they're paying. The CEO of Cape Air knows that he's paying $5,000 or $6,000 per premium now as opposed to $1,200 several years ago, whether that's through the agent of the government or whether it's through buying that insurance in the private market. That grocery store, again, that I hear from in my district that is struggling to do the right thing and provide health insurance coverage for their workers, but failing to do so because the costs are going too high and saying, I'm going to give up, I'll just pay the penalty because this is too much. They know that they are paying through the nose. And I think we underestimate Massachusetts residents when we raise the specter of saying, well, taxes are going to go up, without talking about what are you paying, right? Let's just talk about what are we paying, whether it's through this mechanism or that mechanism. And we know, again, it's foolish and stubborn of us to not look at other examples around the world and the country where other systems have been able to pay less for the same or better quality. And lastly, Madam President, I would just add that the gentleman from Oxford raised the concern that this benchmark concept is an impossible one for us to achieve as a state, that it is an unknowable thing, this benchmark. And hearing that argument, I was sitting here at my desk fiddling with this little pen, this little goofy pen that has these little wings on it, and remembering where I was a couple weekends ago where I got this goofy pen with the wings on it. I had the incredible opportunity 2 weekends ago to be in Cape Canaveral, Florida, where I was attending the induction ceremony of my father into the Astronaut Hall of Fame. And on the same day of that induction, they gave the families of the astronauts this incredible opportunity to go into the hangar where 2 of our retiring space shuttles are sitting and are being serviced and decommissioned and ready to go to be displayed in different museums around the country. And, as a child growing up with my dad in the astronaut corps, I had been able to go at the Johnson Space Center into the simulators, but I had never seen the real thing, the real orbiters before. And it was an awe-inspiring, humbling, just incredible experience to go into the flight deck and the cockpit and in the mid-deck where so much of the scientific experimentation over the years has happened, look out the windows, and most of all, to stand underneath the orbiter and look up at the underbelly of it, at all of the tiles that were, burnt and scarred and pockmarked from the re-entry of this shuttle's last flight, and to think about the incredible engineering feat that this country achieved over the years of the life of the shuttle program, figuring out how to construct these orbiters, and not just to construct them for one use, but how to retool them and service them so that these shuttles could go back into service dozens of times through launch and re-entry, dozens of times. And thinking about what an incredible feat of engineering that the United States of America was able to achieve because of the incredible minds that we have in this country and the goal that our public sector set of achieving manned spaceflight and women's spaceflight. And I think, so clearly, if we can do that, if we can achieve that incredible feat, of course we can achieve a sensible single-payer benchmark against which we will compare the performance of our current system under this reform. Of course we can do that. Will it have a margin of error? Yes. Will there be tweaks that we might need to make along the way? Yes. But to say that it's impossible for us to know that is to underestimate the great minds that we have here ready to do this work in Massachusetts. So again, Madam President, I hope that this amendment passes, and I hope that we undertake this thought exercise boldly and again with humility and with recognition that we are not crossing the threshold yet into committing to implementation of anything that we deem unadvisable as a state, but that we ought to ask the smart questions that our constituents are counting on us to ask in order to steward their dollars. Again, whether they be tax dollars or private sector dollars, they're their dollars and they know that they're paying too much right now. Thank you, Madam President.
Seat appears and the clerk will call the roll.